So it looks like Elizabeth Warren has finally released her plan to raise money to fund a Medicare for All plan that she's been talking about through this whole Democratic primary process. And she's come across a lot of pushback from people saying that there's no way that she can do this without being able or without raising taxes on the middle class. And I think that's really the main critique of anybody's plan for some kind of Medicare for all or single payer. It's just going to undoubtedly cost trillions and trillions of dollars. And there's no way to do this without actually raising taxes on everybody, including the middle class. Sure, I know it's fun to fantasize about taxing billionaires, billions of dollars, and ending the wars, which I'm 100% in favor for. But the idea of taxing wealthy people, obscene amounts of money to pay for social programs is just crazy. And it's that alone cannot pay for all of the stuff that a lot of these people, including Elizabeth Warren and Bernie Sanders, are proposing. Taxing billionaires more can certainly make a little bit of a dent, but really you're leaving out all of these downstream taxes that also come into effect that affect people in the middle class. It always fascinates me when we talk about the middle class because the middle class really encompasses a lot of people. You have anybody from like somebody you imagine being a standard middle class person, I guess somebody who works a 40-hour-a-week job, 9 to 5, brings a hungry man lunch to work or a lean cuisine to work. Their kids go to public school and play soccer and dance. One of them's a little unsure of their sexuality or if they're even the right gender. You got anywhere from that to, a little bit lower than that, where people aren't living in poverty, but they're also not doing very well, living paycheck to paycheck, which if you're in like the middle class, I don't know if you are particularly living paycheck to paycheck, although you probably have a lot of credit card bills because that tends to be a habit of middle class. And then you got upper middle class, which are probably doing, probably have like 2 income earning parents who are maybe senior management, maybe even like low C-level, making probably combined 6 figures a year. And kids are going to school. One kid is doing, fairly well in school. One kid is, discovering weed and probably developing an oxycodone habit or something. So this is all that's going on in the middle class right now. It's a very big swath of people. And all of the politicians or all of these people running for the Democratic primary are promising a lot of things to the middle class. And it's funny because as many things as they promise, including Medicare for All, they keep making this promise that their taxes aren't going to go up. And right here, you have our good friend, again, Elizabeth Warren, who released her, her plan to pay for her Medicare for All, saying that I did my homework. Well, good, Elizabeth. That's great. You did your homework. You're a politician. I don't know if you're supposed to have homework. I think you have a staff for that. But if you're doing homework, great. I can relate as a middle-class person because I, too, remember what it was like to have homework. And I got the experts to check my math. Damn you, Elizabeth. You got me there. My plan to pay for Medicare for All will ensure, by the way, good use of hashtags here, because you want to keep that shit trending for sure. Everyone has full health coverage and put $11 trillion back in the pockets of American families. Here's how. And in this video, unfortunately, I can't play it because I am middle class and I'm bootstrapping this whole operation. Elizabeth Warren, will you give me money back to improve my YouTube studio? But basically what she does throughout this whole video is promises that she's going to have a plan that covers people for, all of their health needs. And if you're middle class, your taxes aren't going to go up. If you're above middle class, you are fucked. But if you're middle class, including upper middle and lower middle class, apparently, your taxes aren't going to go up. So if I'm like a middle class parent and a middle class taxpayer, and I go to my job that I only have because I'm trying to pay off my student loans, which, by the way, Elizabeth Warren is promising she's going to get rid of, then yeah, this sounds fantastic. Not to mention, she, throws out some stats like these, 37, let's bring it up here. 37 million people didn't fill a prescription last year. 36 million people skipped a recommended test or treatment. 40 million people didn't go to a doctor to check on a health issue. Even with insurance, costs keep people from getting all the care they need. Yep, that is why we are the 37th ranked healthcare system, the American system is, in the entire world. And yep, insurance has a lot to do with it. The fact that people, don't have the money to cover their premiums and their deductibles and their copays. Of course, that keeps people out of the doctor's office. Skyrocketing drug prices, sure, definitely do. So what is the plan? The plan is to have a Medicare For All plan that takes care of that. But the funding of it is just so not consistent. It doesn't really make sense when you start to really dig into the numbers. And I'll be the first to admit, I'm not a tax person. I don't know accounting. I just know basic numbers. Again, I'm middle class. I went to public school. I didn't really learn a lot. I should say I went to public school in Arizona. I don't know a lot about numbers. However, it doesn't take an accountant to kind of figure out that this might not work as well. What am I saying? So you had this really interesting article come out in the Jacobin, which I'm not an avid reader of that publication, published by this guy right here, Matt Bruning, where and I love the title, Elizabeth Warren's plan to finance Medicare for All is a disaster, which, I agree with you there. And he basically makes the case in this, in this article that the reason Elizabeth Warren's tax or her Medicare for All plan is a disaster is because she wants to enact a head tax for companies to pay. So he's kind of picking at this from the, how will employers pay for this? Or how will we raise money? Well, we're going to raise money by employers actually contributing money where they used to contribute money to their employee-sponsored healthcare programs. Now that those are gone, how are we going to raise money from, what are they going to pay? They're going to pay a head tax. And, he makes the point that that's not a good idea. And, I think he's on to something, because what you also have here is a study that was done by I'll bring it up right now, by the National Taxpayers Union Foundation. And essentially what they do here is they go through and they use the example of Seattle, who recently passed a head tax to try to raise money from companies like Amazon and there's several other, big tech companies in the Seattle area, to try to get more money out of them. So let's read a little bit through this. Seattle's garnered a great deal of national attention for its newly passed employee head tax. The proposal levies a tax on mid to large size employers at a rate of $275 per year per employee per year. Even businesses headquartered outside the city with enough receipts within city limits would be subjected to the tax as well. The tax has been derided as a tax on jobs by former governors and state legislatures. Even Seattle's mayor threatened to veto the tax increase before the rate was lowered. So the reason why this is a problem is because the way that companies get around this, other than just leaving the place where the tax is they either cut jobs so they don't have to pay for as many employees, or what they do is they start to create different entities within the company and start to slowly break up their own company just for tax purposes. And so they start to create these divisions because the stipulation is, and I don't know if this is current or if this is just in Elizabeth Warren's plan, but this tax doesn't apply for companies that have 50 employees or under, so technically small businesses. And it doesn't apply to companies who employ independent contractors. So the way that companies get around something like this is they break up their business into smaller divisions so that they can qualify for 50 employees or less. Or they start to essentially fire their employees and hire people who work as independent contractors, which both of these things, if you're an organization, it's not good for your organization. And of course, it's not good for tax revenue. But Seattle is neither the beginning nor the end of the EHT. Again, that is the employee head tax. In fact, the city already had an employee head tax on the books a decade ago, only to repeal it in 2009 for its negative impact on economic growth and its administrative difficulty. It was said to be penalizing Seattle businesses for creating new jobs, and that was at the comparatively meager rate of $25 per employee per year. The new proposal is more than 10 times that amount. Again, $275 per employee. That's what Seattle was doing. So they go on to talk about other cities that have had employee head taxes before, including Pittsburgh, which was 52, Denver, which was 117, and it was still just a disaster. So since Seattle's announcement, other cities have latched on to the idea of milking big tech companies by making them pay per employee, and they have on their payroll. Silicon Valley is especially enamored. Cupertino, home to Apple, Mountain View, Google's headquarters, are each considering versions of the employee head tax. And this is probably why Amazon was, opening up a whole new location. At first, they were looking at Queens, New York, and then I think they moved down to, I want to say, Virginia, maybe, or some other state on the East Coast. I don't remember exactly which one, but it's because they want to get out of Seattle. They don't want to pay these Seattle taxes, right? What are the effects of an employee head tax? As every economist will tell you, one of its first rules of policy is that if you want less of something, tax it. An employee head tax is no different. Its most obvious and direct effect is to decrease employment, whether by causing layoffs or disincentivizing future hiring. And because an employee making minimum wage makes a business liable for the same EHT as a CEO making millions, businesses have every incentive to lay off low-wage workers, because low-wage workers don't make you money. These are the customer service people. These are the drivers. These are the truck drivers. These are the loading dock people. These are just people who don't contribute. I mean, it's just grunt work. You could hire a kid to do this, right? You could outsource that. You can create technology and robots to get it automated. You can send that stuff out to places like India and China to get that work done. So, just a complete disaster. Beyond just these effects, an employee head tax sends a hostile message to local businesses at a time when cities are falling over themselves to incite Amazon's new headquarters and the high-paying jobs it promises to their city. Cities that tax employers for every job created stand out. Businesses receive a clear message from an employee head tax that the city intends to treat them as a source of revenue to drain, not as a partner that contributes financially to the city that houses it. The distinction is important to businesses. Amazon made that clear in its response, stating, "We remain very apprehensive about the future created by the council's hostile approach and rhetoric toward larger businesses," which forces us to question our growth here. They're talking about Seattle. Smelling blood in the water, other cities are moving to try to lure Amazon away from Seattle. Tacoma, Washington even offered $275 per job created paying $65,000 or more to businesses coming to the city. The fact that this number is exactly the same as Seattle's head tax rate is likely not a coincidence. Tacoma, sticking it to Seattle, as well they should. So, this article kind of goes on for a little while, and, there's a lot of good information in here. But essentially, the case that it's making is that, let's just go to the conclusion. Employee head taxes Tempting as they may seem, as an easy method of profiting off of wealthy tech companies are far more harmful than they are helpful. They punish low-income workers and create a hostile business environment, directly contradicting their purpose of raising funds to address housing crises. Cities should seek to rein in their spending habits or restructure existing taxes before concocting tax schemes like an employee head tax. And this is what the Elizabeth Warren Medicare for All plan is. And so, this is very important to understand this nuance with what she's saying, because what she's saying is that this is not going to raise taxes on the middle class. And maybe you're right, as a middle class person like me and probably you, unless you're watching Jeff Bezos, you're not going to get a new tax on your tax bill, but your downstream taxes are going to be larger. You might not have a job. You might lose a job working for a company that you had a comfortable job working for, because now they are very wary of paying these extra head taxes, right? Not to mention, to raise trillions and trillions of dollars, I mean, the math is just what it is. You can't get around not taxing people more. And I don't know if she has particularly said that she is not going to tax. Well, she's said in this video she's not going to tax people more, but it just doesn't seem possible. It does not seem possible. So let's go through what she's, some of her, this was in the New York Times, the title of the article, Elizabeth Warren's Medicare for All math. So, there's kind of a list here. Ways to reduce the plan's cost, change the way Medicare pays for certain types of hospital stays, such as paying a package rate rather than different fees for surgical services, and paying doctors in hospital-owned practices the lower prices paid to those in private practice. Let me say this. Doctors not going to be happy about that. Hospitals not going to be happy about that. Although hospitals and doctors, you can make the argument, are quite overpaid because they are sending these, astronomical bills to insurance companies, and they probably won't be able to do that to Medicare. At the same time, what is your level of service going to be? For instance, if you're paying for a lower price good in a hospital, is that something you really want to be okay with? Do you want to pay the least priced surgeon to do surgery on you, or do you want the higher priced surgeon to do surgery on you? Why do you think their prices are two different prices? Maybe because one is actually a better surgeon than the other. Do you want a surgeon cutting out your gallbladder who is fresh out of their doctor program, fresh out of medical school, and they're just trying to get their surgery chops? And, if you're trying to get your surgery chops, you might be chopping people up a little bit more than you like to, versus the surgeon who's done this 1,000 times and has earned their keep. Or let's take a gallbladder surgery again as an example. If you need to have a gallbladder surgery and there are specific instruments that you use in a gallbladder surgery, one of which is it's like a specific clamp that keeps the bile duct in place. You could either have the brand new one of those clamps, or you could have the old version of the clamp. Maybe in some regards it's just as good as the new version, but maybe in some regards it's not as good as the new version. And the reason they updated it was because there were problems with the old clamp. Maybe the old clamp wasn't so good that it caused a lot of malpractice suits. So, you might be saving money on some frivolous spending, but maybe some of that money that was being spent was to upgrade the quality of care. Assume that the Medicare for All program itself can operate very leanly. The Urban Institute estimated that Medicare would devote about 6% of its health budget on administrators to decide what and how Medicare would pay for things and to prevent fraud. In Mrs. Warren's plan, that rate is 2.3%. That's almost $2 trillion. Assume very aggressive drug discounts. Mrs. Warren believes a government system will be able to reduce spending on drugs substantially, including lower the prices of prescription drugs by 70%. Now, this is something I'm absolutely on board with if you can pull it off. Problem is that you're going to have to sever a lot of relationships of drug people and, Washington people. And if we're talking about, just looking at a guy like Trump, the problems that a guy like Trump has getting things to get passed through a Democratic Congress, you're going to have a lot of Republican and Democratic, both congressmen and senators, who are going to have issues with this because a lot of them get their money from drug companies. And I'm not defending this. I think this is a huge problem. And this does probably account for a lot of the, again, frivolous spending in the healthcare industry. But if you're going to lower drug prices by 70%, you're also going to be taking a massive hit to a lot of these drug companies. And a lot of these drug companies employ a lot of people. So if they start making less money, you're going to put a lot of people out of work. And sure, you might put a lot of these, real scummy pharmaceutical reps out of work, but you might also be putting a lot of researchers out of work, a lot of research and development people, a lot of the people who actually do the greater good of developing drugs and researching treatments that actually help people. I'm not a drug person myself, but I know this is a problem. And if we're going to start relying on generic drugs, well, you should really, I don't remember the name of the book, but there's a lot of literature now coming out about the polluted generic drug supply that's actually causing a lot of complications, and a lot of it has to be recalled because they're finding carcinogenic elements in a lot of these generic drugs. You don't want to fuck with that. You also have to assume slower growth in health spending over time. The federal government now thinks health spending will increase by 5.5% a year. The Warren campaign assumes 3.9% growth under Medicare for All, closer to the growth rate in gross domestic product. Assume lower payments to hospitals. They're not going to be happy about that. The campaign believes that hospitals can be paid around 110% of what they are currently paid by Medicare, a number that would cause some hospitals to operate at a loss. Currently, private health insurers often pay a lot more to hospitals than Medicare for similar procedures. And look, Medicare, once it's run by the government, or is run by the government, but once that private health insurance population comes into Medicare, and Medicare has essentially a real tight budget to work for, you think that they're going to be any more willing to pay for expensive procedures than your private health insurance is right now? I'm going to take a pretty solid guess and say that they're not. The advantage of having private health insurance is you get some more ICD-9s that they'll cover and that Medicare won't. So Medicare might tell you that they're going to cover everything, but they can't cover everything. And if they do cover everything, then this bill that we're talking about, the amount that it's going to cost for a Medicare for All plan is going to be substantially higher, because I really believe that these politicians and these mathematicians who are checking Elizabeth Warren's homework are vastly underestimating how sick people are, especially when you put 30 million new people onto this Medicare for All plan who don't have insurance, who are sick, and then the millions of people who didn't go to the doctor, the millions of people who did not fill a prescription when they start going to the doctor and need more things paid for. It's gonna be a real interesting problem. So that's my thoughts on the Elizabeth Warren Medicare for All plan and the math of her plan. It's real interesting to look at the idea of Medicare for All. It's obviously a thing that everybody believes we need. We need to do away with this problem of, healthcare costing so much. And the problem is, it's not just one thing. It's a multifactorial issue, okay? It's not just insurance companies. It's the supply and demand of medical costs going up because there is such a demand, right? And sure, you can say that insurance companies or providers, drug companies have manipulated people into getting more care, but we know that the highest the highest rate of disease that is paid for by health insurance actually comes from chronic disease, okay? And chronic disease is a result of lifestyle. You know, I'm not talking about people who have to go to the hospital because they were hit by a bus or because they need an emergency surgery or, they get struck with, an emergency cancer. I'm talking about the people who have chronic heart disease, who have the diabetes, who are at risk for cancers, who have the autoimmune diseases. These are the people who are taking up, not to mention the mental health industry, the people getting the antidepressants, the anti-anxiety medications, the overprescriptions of all of these cares. This is what is sucking up the budget of our healthcare system. And it's the reason why all of these other services cost so much. So yeah, it's fun to talk about this world of, hey, we can bring costs down by just taxing people more. But as you see, taxing corporations more is not the answer. In fact, as you can see, the downstream effect is actually going to be a tax levied on people, not to mention unemployment of these people who are working for the companies who now need to pay these taxes. So it's gonna be interesting to see how this whole thing plays out over time. But let me know what you think. Everybody has their own thoughts on this. I'm always willing to entertain different sides of this argument because, it's all speculation. Our healthcare system is a living hell right now. So there are ways to improve it. And I think everybody has the ability to kind of come to the forefront and put in their opinion because everything counts. So let me know what you think down in the comments. Unless you got a shitty opinion, then your opinion doesn't count. Let me know down in the comments what you think. Also, if you enjoyed the video, please give it a big thumbs up. Remember to subscribe to the channel. And if you enjoyed the video and you think I made some good points, please share the video on your social media and with people that you love, or maybe even you hate. Thanks so much for watching, everybody. I'll catch you on the video tomorrow. Have a great day.